But endometriosis is not always necessarily about flow, right? It affects a ton of people. It can take many months for this to be diagnosed, and there's a significant burden to our culture by this, because the how it presents is not necessarily as obvious as they say the way a fibroid. You can have heavy bleeding, you get an ultrasound, there's a fibroid, boom, done, right? Endometriosis can be a lot more difficult. And so endometriosis, by definition, is that tissue, and again, it's not exactly the endometrium type tissue because it's not behaving the way it should be. So rule number one is that endometriosis is not just normal endometrial tissue just in the wrong place. There's something about it that puts it in the wrong place, and it behaves slightly differently. So it can be then on the outside of the uterus itself. It can be actually on the ovary. It can be on the tubes. And of course, it can go even further than that. It can be on, the bowels and other areas of the abdomen, and it can go far reaching. And so endometriosis then can be a little bit harder to diagnose because sometimes these little implants are flat. Sometimes this doesn't present then as heavy bleeding, doesn't necessarily present as abnormal pattern to your menstrual cycles, but it can present as more pain, and that the symptoms can change with time. And so that is part of the reason why it can be hard to diagnose. The pain with endometriosis tends to initially start as being around that menstrual cycle time of your month, because that's when the lining that has been stimulated on the inside of your uterus to grow. If it's elsewhere, it's also been stimulated by those same hormones to grow, but it's relatively stable often in early endometriosis until the hormone triggers are telling your uterine lining to shed. But now these little tiny implants that are satellites all over the place are shedding wherever they are too. And so then that can mean then that pain and some of those symptoms that start off in early signs of endometriosis can start concentrating right around the time of your actual menstrual cycle.